is Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal.
Hello and welcome to Your Health. I'm Barry Morgan. You may be familiar with the 811 Info-Santé telephone service. You call that number, you speak with a nurse who can help if you're having a health problem. Did you know there is a similar service where you would speak with a social worker? It's 811 Info-Social. To tell us more about the service, we welcome Paul Fortugno. Mr. Fortugno is a social worker at 811 Info-Social. Paul, first of all, thank you very much for being here.
You're very welcome.
So how does it work when someone calls the Info-Social line?
Well, you need to call 811 first, and you'll be directed to an automated system where you'll have a choice between English and French, of course. And then afterwards, you can choose between speaking to Info-Santé, a nurse, or Info-Social. Once you've chosen Info-Social, then you'll be directed to two other choices, which would be information or crisis. Once you make that choice, then you'll be directed directly to a social worker.
Okay, so when should someone actually call 811 Info-Social?
For any purpose that's associated with your social functions. Okay, when you're not doing too good, you're wondering what could be done about it, you could give us a call. Okay, we receive calls of all sorts. It could be an information call, for instance, as a loved one that's calling for an elderly person to find out what kind of services the CLSC could give them.
Okay.
It could be a prevention call where a problem already pre-exists but is not too severe, and where the person needs a little bit of help to orient themselves. Or it could be a crisis situation with or without an emergency and with or without dangerousness, such as suicidal calls, homicidal calls, or just a person that's going through an anxiety attack and needs help to avoid having to go to the hospital because of that.
So what if somebody does call because they're going through a crisis?
Right.
So what happens?
We'll create an alliance with the person because she's the one asking for help, and we need to establish a trust, right? So we'll start collecting information, and we'll try and ID if there's dangerousness going on and if there's an emergency, okay? If there is an emergency or dangerousness, we'll try to do an intervention to avoid that this person should end up at the ER, for instance. Okay, we have approaches to do that where we're going to identify what the person's strengths are, what her solutions are, and more than likely we'll be able to avoid such a transport. Okay.
If somebody is in such a situation where, say, they're threatening to take their own life, for instance, do you send emergency services to their residence?
Not necessarily. We'll try and see, because when it comes to a suicidal crisis, a person, when they're calling us, always has an ambivalence. Okay.
Ambivalent?
They're ambivalent, right? Where there's a part of them that wants to die and there is a part of them that wants to live. Our job would be to try and identify the part of them that wants to live and make it grow, thus making the part that wants to die become smaller, right? So by doing that, more than often, we don't have to send an ambulance, okay? And we'll ID, like I said before, their own solutions because they're master of their problem, we're master of the process.
I see.
So we do sometimes send paramedics. It could happen that there's an emergency that we're not able to reduce.
Or to deal with on the telephone, I guess,
exactly.
Where a person-to-person intervention would be necessary.
Yes, exactly.
Paul, what are the most common reasons, maybe the couple of three most common reasons people call?
Well, the most common reason would be mental health issues in adults. Okay, you'll have the patient themselves that would be calling because they're not going too well and they'd like to have solutions and they need a caring ear, for instance. Sometimes you'll have loved ones that will call because, for instance, there's a new diagnostics. They don't understand that diagnostics. They need help to intervene in regards to their loved ones. We do have other types of situations. Any human problem could be brought to our attention. It could be, for instance, loved ones that are calling to find out about resources for their elderly person, their loved one that's an elderly person. Okay. It could be a parent that's having a hard time with their youth, for instance, that needs help to deal with the situation. And we'll address the problem with them.
In a case like that, a parent calls their child, a teenager has various issues. Maybe you could give us an example and what would be done in a case like that.
Well, for instance, you could have a teenager, let's say at 14 years old, that's going through their adolescent crisis, okay, where they're opposing their parent and where they're taking drugs and they're sometimes being violent.
And mom and dad don't know what to do.
They don't know what to do. So we'll help them to establish strategies. When you're a teenager at 14 years old, to oppose your parent, is absolutely normal. Okay, so we'll try and divide what's not normal from what's normal and address the question that is not normal. Okay, we'll help them establish a parental structure that will help them be stable with their parent, with their child, stable consequences, for instance, and we'll refer them to the proper services in the community if needed. We refer a lot in the sense where whether it's a suicidal crisis or if it's just a person that needs services from the CLSC, we'll orient the person to the proper place and sometimes refer them as well. We may call sometimes a crisis center, for instance, for some patients that need help right away.
Which makes sense, obviously. You're there to help, so you'll take whatever steps are necessary to help this individual who is in a crisis situation.
Exactly.
Does the service serve a particular territory or area?
Most of our calls are from the island of Montreal, okay? But sometimes we do get calls from outside of Montreal, from the province, because some people will call with cellular phones or with IP phones, and or some regions as well. Sometimes they won't have a social worker on call, so their calls will be referred to Montreal, and we'll deal with them.
Mr. Fortugno, what are the advantages and perhaps the disadvantages of working on the phone as a social worker?
First of all, the biggest advantage is that these people have a response from a social worker. Most of our calls, we respond within 4 minutes. 90% of the calls, we respond within 4 minutes.
Hang on, that bears repeating. 90% of the calls to Info-Social 811, there's a response to those callers within 4 minutes. That's pretty remarkable.
Yes. So we have callers that are on waiting lists at the CLSC or in other places and that need help right away, so they could give us a call and we'll give them punctual intervention. Now, of course, we don't have access to the immediate surroundings of the person when they're calling, right? The only thing is we develop an expertise where we're going to be attentive to all the signs that we hear over the phone, how the person is breathing, for instance, what's going on in the background. And we will adjust our interventions in regard to what we hear. So there's an expertise that we developed over the years in telephone intervention.
So even though you're not physically seeing somebody, they're at the other end of a line, they could be around the block, they could be a few hundred miles away.
Exactly.
But as you said, you're trained in such a way that despite not having your eyes, so to speak, you're using your other senses to more or less investigate what's going on?
Yes, indeed. And we ask questions as well, in the sense where, for instance, if we have a suicidal patient, it seems to be depressed, we'll ask them how their physical hygiene is going, how their apartment, is their apartment, how would I say?
What condition it's in,
yeah,
I guess.
Exactly.
Yeah.
Disrupted or not. Yeah.
Interesting. And then you'll do whatever would require to be done based on, how much time could you spend on the phone with somebody?
Well, it varies. It could be from 2 minutes to an hour. So it depends on the situation and the work that needs to be done.
Interesting. What about like new technology? Is that going to factor into the kind of work that you do?
Sure. The ministry is working on projects right now, for instance, to appeal to the younger generations, such as text messages and Skype and technologies like that. They're not implemented right now, but serious work is being done in regards to this.
Also, there could be a day really reasonably soon, I suppose, where it could actually be, let's say, FaceTime, for instance, or...
Well, we haven't had a date or anything like that when it comes to FaceTime, but for text messages, I know that it could be in the oncoming years or months.
Interesting.
Yeah.
Okay. And what do you like about working at 811 Info-Social?
Well, what I do like is... in regards to the défi, how would I say?
Challenges.
The challenge, yeah. The challenges that expertise that we developed by working over the phone, we're helping people that would sometimes not have a response by any other mean. Yeah. Because they're waiting somewhere, and we're preventing as well that people would be transported to the hospitals in many ways. So that's what I like. I like comforting these people, helping them out in a period where they don't have too much help, helping them find solutions to their problems. Yeah,
that's pretty good right there. Mr. Fortugno, thank you for your time. Very, very much appreciated.
Okay, you're welcome.
That is Paul Fortugno, a social worker at 811 Info-Santé. And that's it for this edition of Your Health. Thank you for your time. To hear our previous programs, you could find them at podcast.ciuswestcentral.ca. That's podcast.ciuswestcentral.ca. And let us know if there's a topic you'd like us to explore in the future. I'm Barry Morgan. Until next time.
You've been listening to Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal.